AEEDC Stories, in partnership with the Sports Dentistry Podcast, is here with MyoBrace. Now, I came over to the MyoBrace stall because I know a lot about MyoBrace, but I didn't realise you were actually Australian. Well, I thought it was based in America because that's where I did some curriculum. So it was really interesting because I used to live in Australia, and then I seen your name was Farrell. So I was like, there's a bit of an Irish connection here. We must have a chat with Chris. So we're here with Chris. You would be the founder and CEO?
The founder, yes. We started about 35 years ago and designed the appliances basically for TMJ originally, and then for orthodontics, and then now for sleep dentistry.
And you be a dentist yourself, and what was your background then? Were you seeing a lot of people with TMJ issues, or are you an orthodontist, or how did it develop? How did that MyoBrace connection develop?
General dentist, but my father was a dentist. He did orthodontics. And I went and worked in England on the NHS for a while, and then started to do some TMJ courses and started to find out a lot that dentists didn't really understand, and that is the external factors like mouth breathing, incorrect swallowing patterns are really causing TMJ disorder and the major contributor to orthodontic problems. And just about everyone disagreed with me then, and so, well, I think I'll make an appliance that treats these problems simply, but also assists people who are trying to do correct breathing and myofunctional habits, like myofunctional therapy, to make it easier and more widespread and more adaptable to the dental practice and the orthodontic practice.
So talk us through your products, like what type of products and when would they be used, and what type of patients would they be ideal for?
Well, we're sort of globally the leaders in early treatment for orthodontics. That is, you take a child from 4, 5, 6, you can see the signs of malocclusion developing, but those problems are really mouth breathing and incorrect function, which are causing the jaws not to grow correctly. And this is in the majority of children. So what we're known for is early intervention of orthodontic problems, and our K-series is the most widely used appliance now for early treatment, pretty much in the world. But then we've gone on to adapt to myofunctional orthodontics, in other words, regular orthodontic treatment, but treating function and causes and mouth breathing as the causes in conjunction with aligning your teeth at the same time, getting a better result, more stable result, but also in many countries more cost effective. There's not a lot of skills involved. There's a lot of learning, understanding other factors other than looking at teeth. You're looking at mouth breathing and breathing disorders. And more recently, we've moved into treatment of sleep disorders. Sleep dentistry has become quite an aspect of dentistry now, and we've been really treating that problem for 3 decades by treating mouth breathing first, and then when we get to the adult patient now, we have a complete range of MyoSir appliances, which are for the adults with sleep disorders.
So there's a little bit of debate about when you should start treating with children, but how do you feel from your experience and from the myofunctional therapy type experience? When would you start looking at making some changes to?
Well, we say to doctors, you evaluate the child, and as soon as you see a problem, you should be treating it. So you can start at any age. 3, 4, 5 is probably the earliest where you can get cooperation, but you should be treating the myofunctional causes as soon as you see them. Most common time to use is the early mixed dentition, because you're aligning the teeth as they're coming through, and you're treating the causes of malocclusion, and then the children will grow better. So the growth and development aspect of our treatment is the most effective in that 5, 6, 7, 8 years of age. And when the child comes for orthodontic treatment, and the teeth are all already crowded and they already have arch development problems, the treatment, we can still do the treatment, but it's more complex. So we like to be treating the cases as early as possible. But as soon as there's a problem, as soon as we see a problem, we're trying to treat it.
So you're based in Australia, but you're worldwide, because that's obviously I thought you were from a different part of the world. So do you have partners about, and how do you operate?
Well, the company is me. There's no shareholders except me. But the they're coming out worldwide. We have a regional office in Europe, in Holland, and one in US, and also in Shanghai in China. And we have distribution over 150 countries. So, but it's all done. Everything's done in Australia. All the design work, all the graphic design, all the concepts. We have a training program for all on video to teach children how to breathe correctly and how to swallow correctly. And we're first to do all animated cartoons and to train the children how to basically grow up with correct breathing and properly aligned teeth.
So it's not just the product yourself, you're also providing support for education. So say as me as a dentist, and I wanted to treat somebody with a MyoBrace in Ireland, I would be able to get the product, but also I have that support to be able to provide my patients where they can learn.
Yeah, we have a very big online training program on myoresearch.com, and that can take the doctor through from a beginner all the way through to how he or she can treat the patients. That's for orthodontics, TMJ disorder, and sleep disorders. But also we have our MyoBrace and our Myosa websites, which have all the training programs for the children and the adults. So they're the end user education program. So very, very much, they were very much into education, and that's all pretty much gone online now. And the doctor just signs up, and they can go through all our programs. And we do live lectures as well, but mostly everything's online now.
So it's great. So anybody in the world that wants to know about MyoBrace, they can get online, get educated, and start using. You were just saying to me, you've been coming to AEEDC for a while. How have you noticed? Have you noticed a bit of a difference in AEEDC, and how has AEEDC been for you?
Well, it's interesting. Well, I think we must have been here 20 years ago, and I haven't been here since before COVID. And I'm astounded about the size of the show and the quality of the booths here. I haven't got around to see everything yet, but it's staggering to see how much it's grown in that period of time.
Yeah, it really is. It seems to be, from talking to other people, the place that you want to go now to show what you do and get people interested in.
I think for this region, it's like I would liken it's like the IDS in Europe. I mean, this is I'd say the biggest I would have expected for UAE. It's an amazingly large show. But before it looked like a bit of a regional show. In that period of 20 years, I'm amazed how it's grown in size and obviously in quality as well.
Yeah, and you're from Australia, which is a big sports country. I'm with the Sports Dentistry Podcast. I mentioned in the podcast earlier on in the year that it depends on what part of the world you are, and in Australia itself, it depends on what state you are. For when you say the word football, it could mean a completely different sport. So what sport of it, if you were to say football, what sport would you be referring to?
Well, we definitely, well, at school I played rugby and league are the two. So down south, in Victoria, they have this funny thing that we call Aussie rules, and they probably call that football, which is huge now. And then we call soccer. You can call football. But that's also huge. And
so I'd say in Queensland, football would be more rugby league. What rugby league would
pretty
be
much big? If you're saying I'm going to the footy, you're going to see rugby league.
Yeah. It's interesting how it means so many different things.
We're all speaking some sort of English, but everything's slightly different.
Yeah. So thanks very much for spending some time with us, explaining what MyoBrace does. And if anybody's looking to check them out, get down here to AEEDC and have a chat with Chris, and he'll be able to explain everything to you.